very much, everybody, for joining. I'm happy to have you here, and I hope this webinar will be informative and interesting for you. Today, we're going to talk about the Tiny Thermode, the latest release for our TSA2 device. This Thermode, his name says it. It has very small stimulation surface, and brings very interesting opportunities for your research or clinical work. And today we will discuss all of it. Those of you, by the way, who have our previous devices might know this thermode as an intraoral thermode. That is how it was called. But we felt that it's, not giving it enough credit because it is good not only for the intraoral testing, and I hope that you will see this in today's webinar. All right, so what do we have in today's talk? We will talk about the overview of the TSA2 device, because I believe that some of you attended our previous webinars and saw the webinar about the TSA2 device. Some of you maybe own their TSA2 device. But for those of you who are not familiar or not familiar enough with the platform to which this Tiny Thermode is connecting, I would give really a short and brief overview of the platform of the TSA2 device, and then we will dive deep into the Tiny Thermode and its specifications and capabilities, and then we will discuss the possible applications of this thermode in different areas. But before we start, I would like you to ask for your cooperation a little bit. Here's a question I would like to ask you. What is the smallest thermode size that you have used in the past? So here is the list of Medoc thermode, 30 by 30 millimeters, 16 by 16, which is smaller. CHEPS thermode, maybe you used it for evoked potentials. Intraoral, which is the thermode we're talking today, the Tiny Thermode in previous devices. Other, so if you could please scan the QR code and answer the question, I would really appreciate it. I'll give you a couple of minutes. Okay, we have a couple of people already replying. Let us see. Maybe a couple more minutes, maybe a minute or two. Okay, let's see what are the answers. So, most of you use the 30 by 30 thermode, which is not surprising because this is the standard one. It is the one that is used for standard QST, so I'm not surprised. And people also use the 16 by 16, the smaller one, and CHEPS. But I see that all of you are new to the tiny thermode, to the small area thermode, so I hope it will be interesting for you. Okay, so let's talk a little bit about the device, as I promised. This is the TSA2 device. It's front and back angle. On the back, you have all the connections. On the front, this is how it looks like. It's a tabletop device. It's not big. Those of you who worked with Pathway in the past, it's much smaller. It is a tabletop and portable device, and it is really our latest release, latest advance in thermal testing. It has a very high precision and in a portable device, as I mentioned, not the big device that we had in the past. It's much smaller and much more portable, and has the precision and knows how to do everything the Pathway did and even more. It has a lot of software and hardware capabilities, which makes it a very nice tool for different types of thermal testing. It can be a simple static QST for testing the warm, cold threshold, pain thresholds. It can be dynamic QST, conditioned pain modulation, temporal summation. It can be used for CHEPS, evoked potential test. It can be used in combination with other types of stimulation, like visual and audio, having everything controlled by the same external software. Really a lot of capabilities this device can offer you with the right accessory. One another advantage of it, that it is extremely easily upgradable. You just need to add your accessory for what application that you like to test, and it's like plug and play. You can use the 30 by 30 simple thermode with the response unit and have it used for a simple standard QST, static QST. You can use two thermodes simultaneously to stimulate different body areas in parallel or sequentially. You can use CHEPS thermode for very fast, rapid stimulation, which can be useful for evoked potential test, can be useful for temporal summation test. You can take some of the thermals into the scanner and use it during fMRI scan. And the topic of today's talk is this guy here, the intraoral thermode, which we will review in details. It is also very easily upgradable to this configuration. So let's talk a little bit about this tiny thermode, this small thermode that we just released for the TSA2 device. So it is really easily connects to the TSA2 device with electrical connector and the water connectors. I hope that you can see it. I'm holding it in my hand. It is very easy to hold, uh, very convenient, and it has this small stimulation surface, which we will discuss later, and it has this little angle that allows us to apply the thermal stimulation on different body areas more easily. The tiny thermode specifications are on this slide. So the diameter of the thermode is 6 millimeter, like it was in previous thermodes for previous devices. Um, and it is pretty small. It works in a wide range of temperature from 0 to 53. Now the temperature range is depends on the protocol. Some of the protocols are a little bit more limited because of some safety limitations we have. It is important for us to make the stimulation as safe as possible and not make any damage to the tissue. So in some protocols, the upper limit, for example, is not 53 but 50. It depends on the protocol. Um, the change rate of the temperature is up to 3 degrees per second for heating and up to 1 degree per second for cooling. Now, when you go under the 10 degrees, it can get slower, 0.5 degrees per second. And when you are close to zero, it can be even a little less. That's because the cooling to these extreme temperatures is quite challenging. But it works in wide range of the temperature, and these are the temperature change rates. And there are additional capabilities of the Tiny Thermode, which are, these are the capabilities of the TSA2 device with the Tiny Thermode. So first of all, there is a dual thermode capability. You can connect to your TSA two thermodes simultaneously at one time. One can be a tiny thermode, both can be tiny thermodes. And then you can stimulate two body sites in parallel or sequentially. So it opens a wide range of opportunities to implement this in more sophisticated protocols, in some multi stimulation protocols, something that can be interesting to apply. There is a feature of external control that is called of TSA2 that is called external control. This feature actually allows an external software to have, to some extent, control over the Medoc main station TSA2 software. The external software can send 8-bit commands to our software, and by that to start thermal stimulation, stop thermal stimulation, select the different noxious or non-noxious program stimulation. And all this is also possible with the Tiny Thermode. If you would like to hear more, by the way, about the external control features, because I will not go into details in this webinar, we have a webinar dedicated to that. You can find it under webinar section on our website. Of course, there are all the standard stimulation methods are there. So if you would like to do static QST using the very well-known and validated limits program method, you can easily do this with your Tiny Thermode. If you would like to apply some tonic stimulation using ramp and hold program, you can also do this. So all the standard methods are in the software and applicable to the Tiny Thermode also. And of course, like all of our devices and accessories, the TSA2, including the Tiny Thermode, is CE and FDA approved. And this is important both for the sake of approving the protocol and the device at your ethic committee at the university, or inserting the device to your hospital. But also, it's a standard of safety. Our devices are well tested and very safe to use because we have all these regulatory certificates. Something that is important to mention, I talk about what the TSA2 device with the Tiny Thermode can do, but I think it is important to mention also what it can't do. It cannot be taken inside the fMRI scanner. The fMRI compatible thermodes are only the 30 by 30 and 16 by 16. The intraoral, the Tiny Thermode comes only in the standard configuration, non-fMRI configuration. Okay, now after we review the device and the Thermode and its specifications and capabilities, we can start talking about the possible and potential applications of this Thermode. It is important to mention that since this Tiny Thermode for TSA2 device is only released recently, the papers you will see in the next section of the presentation are done with our previous devices, with the intraoral Thermode for TSA, for the previous version of the TSA, the intraoral Thermode for pathway, and other small Thermode that we had in the past. But I bring these papers here to give you ideas what can be done with such a small surface stimulation area. So let's start. By the way, if you have questions, you can write them in Q&A section, and I will relate to all the questions at the end of the presentation. So don't worry about it. Okay. So as I mentioned previously, all the standard methods are available. If you are planning to do some static QST, you can use the limits test and do a cold detection threshold, warm detection threshold, cold pain threshold, heat pain threshold, the whole battery or just parts of it. And you will now see in the presentation paper that does only part of the QST testing, or the whole battery, the whole all four modalities. Depends on what you are trying to show and demonstrate, but everything is there and possible. There are also additional QST programs like Levels and TSL. And again, I will not go into details of each and every program. If you are new to Medoc devices and the applications, you can again go to our website. There is a very nice QST webinar that you can watch that really goes into details about each and every program I mentioned here. And if you would like to apply some prolonged tonic stimulation, noxious or non-noxious on small body area, you can use, for example, ramp and hold program and predefine the destination that you go to, the time you will stay there, the rate at which you will go there, well, you would like to return to next destination, or just go back to baseline, from which baseline temperature you would like to start. Everything is configurable, and all the standard methods are there in the software and applicable to the Tiny Thermode also. Let's start from the obvious. Not it was called intraoral thermode for a reason in the past. There are a lot of applications related to intraoral thermal testing, and we will review some of them. Let's start from one of the known conditions, the burning mouth syndrome. This relates to some prolonged or reoccurring pain that has in the region or doesn't have in the region inside the mouth. And there are many papers that used the Medoc intraoral thermodes to demonstrate the impairment in thermal QST as a marker for a neuropathic origin of this condition. So this is one of them. Uh, Mo and colleagues from China, excuse me, did some intraoral testing with Medoc intraoral thermode for previous TSA device. They did the whole battery of the testing: cold detection, worm detection, heat, cold pain, and heat pain. They started from the baseline of 37 degrees. Some of you who did maybe QST on the skin know that usually we start from the baseline of 32 degrees. But going inside the mouth, the temperature is from which you start is usually higher. That's why they use the 37 degrees. And they tested the thermal and mechanical QST in this case, and they demonstrated that the thermal um, thermal modality, thermal testing, demonstrated impairment, but not mechanical. And by that, they supported the probable neuropathic origin of this pain condition. Another work done in burning mouth syndrome patients was done by this group in UK. And they also did thermal testing inside the mouth. They tested different areas on the tongue. And as they used the 5x5, we used to have this small thermode, 5 millimeters by 5 millimeters for the old TSA, the previous TSA version. So they used this thermode, and they started from baseline of 32. But again, the very, very close application. They tried to see if there are some impairments related to small fiber functionality in these patients. And this is just a video that I recorded before this webinar. I tried to simulate the paradigm of Mo and colleagues and the Chinese group that I demonstrated in previous slide. You can see, let's press play. So you can see that we start from the baseline of 37, right? And we start from cold detection threshold. And the temperature stops when the patient is pressing the button. The instruction the patient is getting is press the button when you first feel change towards cooling, first cooling feeling, cold feeling, and then the patient is stopping the stimulation, pressing on the response unit button, and then we do the same for worm threshold. Now you can maybe notice that the rate here is quite slow. This group decided to use 0.5 degree per second and not 1 degree per second, which is the standard QST rate, because they wanted to give the patient more time to react. So they decided to go slower than the standard protocol. And this is also possible. Everything is configurable, as I said. So we can continue. So another reason to take the thermode inside the mouth is to test the teeth, the dental testing, thermal testing. And there are also several reasons to do that, several questions to ask, some related to some disease and its influence on dental sensitivity, some related to some treatments and their influence. For example, this paper uh, shows the use of different QST modalities, including thermal QST on people with periodontitis and with severe infection, severe gum infection, and they did thermal and mechanical sensitivity testing um, to see if there are some impairment, and also to see if the treatment improves the somatosensory function. They used, as you can see, intraoral thermode. This is the previous version, the black one for the old TSA device. And they concluded that the QST may be using a tool to characterize the changes in case of periodontitis. And here's another example by the group from Brazil. A very nice work that they did to see if the dental bleaching can influence specifically the cold sensitivity. Okay, so they also did the standard QST. They started from the baseline of 36 and went at a slow rate of 0.5 degrees per second to assess the dental sensitivity after the bleaching. And they also did a very nice thing. They used also the thermal QST on the hand to test skin sensitivity, and they tried to see if baseline skin sensitivity and a person being more sensitive to cold in general can be a predictor of higher sensitivity, dental sensitivity after the bleaching, and they show that there's indeed a correlation. So also a very interesting work. One additional reason, an additional condition to assess is obstructive sleep apnea. In this very nice work, the thermode was not used on the tongue or on the lip or on the teeth. It was used much deeper in the mouth. It was used on a soft palate, and the patients were assessed in years 2008, if I remember correctly, and then 7 years later to see if there was a worsening in their sensitivity to cold. And they tested the snorers who are untreated, snorers that are treated with the continuous positive air pressure technique, and the people who are just controls that are not snoring. And they showed that really the snorers who are untreated showed the greatest delta in cold detection threshold test. And they hypothesized that the vibration caused by snoring might be causing that, and this be one of the reasons of the development of obstructive sleep apnea. It's also a very interesting work I wanted to show you, because it's not done on burning mouth syndrome, which is um, an obvious reason to test inside the mouth. This is a little less obvious, but also very interesting. Another very interesting direction to go and to test intraorally is what is called thermal taster status. So some of the people are feeling thermal stimulation on specific areas of the tongue as a sensation of taste, even though there is no gustatory stimulus that presents. Some of them feel it as sweet taste, some as sour, some bitter, and there are even other types of taste, like metallic or minty or etc. Umami. This is very interesting direction of research, both for neurological research, but also for food industry, and because people are feeling some kind of taste by only the thermal stimulation being applied. It's quite interesting. And this is one of the papers. There are several papers using Medoc devices. This one is done using the um, intraoral thermode. And what they are doing is not the standard QST that we saw until now. They are using warming trial and cooling trial to see if the warming is causing the sense of taste and the cooling. So for warming trial, they pre-cool the tongue. They go to 15 degrees, and then they go to 40 degrees, and ask the patient, the subjects, if they felt some taste. And for the cooling trial, they are just cooling the tongue to 5 degrees and stay there for a little while. And you can see that there are various types of taste that are perceived. And this is actually very interesting. And I just again tried to simulate the paradigm that they are using, the warming trial and the cooling trial. So let's see. So here we start from the baseline of 35. As I said, we are first pre-cooling the tongue. They did it at 1 degree per second, so it takes 20 seconds to pre-cool to 15 degrees. And then after we are there, we go immediately to the next destination, something that Medoc software allows. You don't have to pass through the baseline. You can define in the program that you want to go to the next destination directly. You can see that the target here is 40 degrees. So we go to the next destination and heating the tongue actually. So this is the warming trial. And now we are back to the baseline and we will start the cooling trial, for which, as I said, we will go down to 5 degrees, again at 1 degree per second. And then we will stay there for 10 seconds, if I'm not mistaken. And this is their cooling trial. Okay. It will, of course, look a little less linear when the thermode is on the hand. It's just a simulation, but just to show you the idea how it looks like. Okay, so until now we discussed the obvious part of Tiny Thermode application, the intraoral testing, dental testing, but this is not everything that can be done with such a small testing area. There are also some interesting applications in the field of genital testing. For example, it can be done for male. For example, this paper that assessed the penile sensitivity of men who were circumcised and versus the intact men. They do quantitative sensory testing, and why it is important to use the small surface. Why can't we use just the 16 by 16 thermode? Because they wanted to assess different and test different areas on the penis. I think they tested like 5 or 6 different points, and it was important for them to assess different areas. And this is possible only with the small thermode. In their case, they were using the 5 by 5 millimeter thermode, but it can be also easily done with the tiny thermode for TSA. It is easy to handle it, easy to apply the stimulation. So in this case, they used what they had. And they, by the way, demonstrated that there is very minor influence on the sensitivity of different areas of the penis caused by circumcision. And there are also applications for female genital testing. For example, if the application is to be applied on the vulva or on the hymen or on the clitoris, you would like to use the smallest possible area of the thermode. So in this case, they also used the 5 by 5 thermode that they had to test the vulvar sensitivity and to compare women with vulvodynia to healthy controls. And there are also more. For example, and this is just one of the examples, here in this paper, quantitative sensory testing was done to periauricular skin around the ear. And in this case, they used the larger thermode. But using the smaller thermode for such areas, like around the ear or maybe on the around the eye, have some smaller areas tested, can really benefit from having a small stimulation area for higher resolution. um, so just one of the examples I wanted to bring you to show you that the sky's the limit, and there are many applications outside the intraoral testing world that can be that the tiny thermode can be relevant for them. So if I conclude, we talked about the tiny thermode and its capabilities, its specifications, and I hope that I was able to demonstrate to you that its small surface in combination with highly controlled stimulation has different uses in intraoral, in dental and genital testing, and even more. I hope it was interesting and informative for you. Thank you very much.